Hi, I'm Dr. Edwin Williams, the medical director here at the Rejuvenation Center, and I want to talk about what it means to be highly specialized in the non-surgical facial rejuvenation arena. And because there's so much out there in advertising, and I see this in social media and I see it people's websites. So this is not a discussion about credentials, okay? I'm going to tell you the difference between, because we have registered nurses that have been injecting for 15 years, and I would consider them highly trained and highly experienced. But I take offense when I see advertisements or postings that this new person in this new spa is highly educated and highly trained. But I know that they were working in the emergency room 6 months ago, and I know that they went for a weekend course, yet you see highly educated and highly trained. On the contrast, as a facial plastic surgeon, we go through medical school, we go through residency, we go through a year of fellowship. So you're learning the anatomy, you're learning all the science behind the injectables. And then even with our registered nurses or our PAs or nurses, we go through many, many months of training here full-time at the Rejuvenation Center before our patients even get injected by someone new. They start very, very slowly with things like Botox. How does that contrast to someone who is maybe doing it part-time? So the questions I would ask if I'm looking for a real expert is, how long is your injector? Can you tell me your injector's name? Can you tell me exactly what their training consists of? By the way, a weekend course by the companies, in my opinion, is not extensive training. I mean, how much anatomy can you learn? Those courses are meant to be refreshers. They're meant to be touch-ups. They're meant to be for someone who's already got heavy training. But someone who's, is your injector, what is their name? How long have they been injecting? Can you tell me exactly, is this something they do full-time? Is this something they specialize in? Or are they working in the emergency room or working in a nursing home and doing this part-time on the weekends? As, an example of that here at the Williams Rejuvenation Center, as a surgeon, I'm the one that set up all the protocols here in the Rejuvenation Center. We're one of the largest Botox injectors in the country, and yet I don't inject patients. I set those protocols up, but because I'm doing surgery every day, I don't think it's fair to the patient, the occasional patient, that I would inject with Botox when I have registered nurses here that are highly trained and are doing it every single day, that are much more likely to get a consistent outcome than me, who does it occasionally, even though I know. So these are things that are out there now, and I think are very, very confusing for the consumer. By the way, what happens if you have a complication? Do you have a physician on staff? We have protocols here for vascular occlusions. It's never happened here. We're one of the largest injectors in the country. But what do you have if there's a complication in place? Do you have a physician you can call right away? And where are they located? Or is it a PA in Florida somewhere? It's crazy to me, but this is the stuff that I'm seeing out there. And it's frustrating because we've worked so many years to really elevate this specialty at the highest level. And we see a lot of people now popping up all over that really don't have training, but they're calling them highly trained or highly specialized. What's important to remember is that these are medical procedures. I mean, Botox is a medical procedure done under sterile conditions. Fillers are medical procedure done under sterile conditions. And the same thing with microneedling or skin treatments. I mean, estheticians, again, this is not a credentialing. This is not here to disparage different degrees or different credentialing, but estheticians can do what they can do within their licensure, but I've heard of places where estheticians are doing deep microneedling. I mean, what if there's a cellulitis, an infection to the skin from that? Or I've heard of places that locally that are promoting some of their estheticians for taking off of skin tags. A skin tag can look like an amelanic melanoma, which can kill someone. Is that being sent off for pathology? And I think these things are very important for the consumer to know. Who is seeing me? What are their credentials? And are they staying within the lane of their credentials? Like I said, we have very highly trained registered nurses who've been with us for many, many years, who have a lot of experience. That's very different, for example, than maybe a family doc who just went to a weekend course. So this isn't really a credential issue. It is a credential issue, but it has to do with experience and training as well. So it is important to remember that these are medical procedures, and it's important also for you to ask the right questions.